Hello everyone, welcome to my next video. Today we will discuss about the factors affecting drug absorption from non-peroral route. Factors affecting drug absorption from non-peroral route. What is this non-peroral route? Oral route. That is the alternate route than that of this oral route. So, what are the other routes which are used for drug administration than this oral route? And some of the routes are buccal sublingual route, which used oral cavity for drug administration. Then we have rectal route, then intramuscular route, subcutaneous route, then nasal route, pulmonary route, intraocular route, topical route, vaginal route. These are all alternate routes of drug administration. Alternate to oral route. So that is known as non-peroral route. Non-peroral route is nothing but the alternate route of drug administration other than oral route. Oral route has so many drawbacks. Like oral route has low bioavailability or limited bioavailability because of some GI side effects. Like some drugs may get first pass metabolism, that is the drug blood flow from the GIT will be emptied into the liver. So liver is the organ of metabolism. The drug may get metabolized, which leads to low bioavailability. Sometimes the drug may get degraded in the GI region, either in stomach or in intestine. Even some drugs may get metabolized in intestinal region because of microflora and the enzymes present in intestine. And some drugs may have less absorption because of the transporters present in the intestine region. The transporters, mainly the efflux transporters, leads to reduction in absorption. So there are so many factors which will affect the oral drug bioavailability. So to increase the oral bioavailability, what we can do, if we cannot increase the drug bioavailability orally, then we can go for the alternate route of drug administration, that is non-peroral route of administration. And now we have to discuss about all the factors which are going to affect the drug absorption through this non-peroral route. Let's see one by one. First is buccal or sublingual route. So the buccal route is given through the buccal cavity, that is inside the cheek and the gingival region. That region is known as buccal. Inside the cheeks, the formulation given inside the buccal cavity is known as buccal, and beneath the tongue, just below the tongue, is known as sublingual region. Buccal means that is between the cheeks, and sublingual means beneath the tongue. So both uses oral mucosa for drug absorption. It doesn't go inside. We don't swallow the drug inside the stomach, but the drug absorption will take place from the oral cavity itself. Now the drug absorption takes place in oral mucosa. Why this route can be used for drug administration? Why this route has been preferred for drug administration? The reason is the oral mucosa is highly vascularized. What does it mean vascularized? Blood flow. Blood flow will be more throughout the oral mucosa. Immediately when you chew the tongue or your cheeks, you will have blood flow, because blood flow is more in oral mucosa. So because of high vascularization in oral cavity, also the epithelium has high permeability. This route is preferred. So what type of absorption will be there for this type of route? So passive diffusion and carrier mediated transport are the most preferred route through which the drug absorbs through this oral mucosa. So which kind of drugs can be given? What are the examples of those drugs which can be given by this route are anti-anginals, and antiarrhythmics. That is mainly the drugs which involves cardiac activity. So if you need rapid onset of action, you can go for this sublingual route or this buccal route. Nitroglycerin, sublingual nitroglycerin is available, which is used as an anti-anginal drug, which gives rapid onset of action when you administer this nitroglycerin through sublingual route. So when you need rapid onset of action, apart from this IV route, you can prefer this sublingual or buccal route also. Like anti-anginals and antiarrhythmic drugs can be administered through this buccal or sublingual route. Now, what are the factors which will affect the drug absorption through this route? Since it is passive diffusion is the mechanism, lipophilicity and the ionization constant. Apart from that, molecular size, pH of the saliva, pK of the drug will have may affect the absorption through the buccal and sublingual route. Now the next route is rectal route. Rectal route generally preferred for pediatric and geriatric patient. That is in case of children. Pediatric means children. Pediatric doctors, that means children. Geriatric means senior citizens, that is adults, more than adults, the elderly patients, they are known as geriatrics. So in case of pediatrics and geriatrics, this rectal route is preferred because pediatrics and geriatrics have problem in swallowing. They may also have the issue with parenteral formulation. They may have pain to have parenteral formulation. In those cases, you can prefer this rectal route. Rectal route is mainly preferred for this pediatric and geriatric, that is in case of children and elderly patient. So the dosage forms like solution and suppositories can be given through this rectal route. Now why this route is chosen? Because it is having high vascularization. Again, there is hemorrhoidal veins nearby the rectal cavity. Also the blood flow also is very much in case of rectal region. So the drug may either get absorbed through the blood capillaries or through the hemorrhoidal veins, and the drug also can enter through these capillaries, and the drug absorption will be more in case of rectal region. Again, what are the factors which are going to influence this site, that is rectal region, is that it has a smaller surface area. The surface area available for absorption through this rectal route is very small. That is one limitation. And another is that presence of fecal matter may affect the drug absorption. The fecal matter presence may act as a barrier, or sometimes it may change the pH of the drug also. So the drug lipophilic and the drug's pKa will have effect in the drug absorption through this rectal route. Now next is IM route, that is intramuscular route. So generally 3 muscles will be used in case of absorption, that is deltoid muscle, then it is vastus lateralis, and the third muscle used for drug absorption is gluteus maximus. So where these muscles are present? So the deltoid muscle is the arm muscle or the shoulder muscle, and the vastus lateralis is the muscle of thigh muscle, and this is the muscle of buttocks muscle. So the blood flow is also in the decreasing order I have mentioned, that is deltoid muscle have the maximum blood flow, then the thigh muscle, and lastly the buttocks muscle, which is known as gluteus maximus. So blood flow is most in case of deltoid muscle, least in case of gluteus muscle. Now the drug absorption through this route depends upon the lipophilicity of the drug, pKa of the drug, pH of the region, then viscosity of the formulation, and also muscle integrity, tissue rejection. These are all the factors which will affect the drug absorption through intramuscular route. So what type of drugs can be given through this intramuscular route? Generally, steroidal drugs can be administered through this intramuscular route. And then we have another route, subcutaneous. Again, this is also the parenteral route of drug administration, that is just below the region, skin region. We have three layers: epidermis, dermis and subcutaneous layer. So the drug is administered to the subcutaneous layer. When the subcutaneous layer is preferred, when the oral absorption is not acceptable, then we can go for the alternate route. And also when the rapid action is not necessary and it have to be given in the parenteral route, and it is for a chronic period of time you have to administer the drug, then you have to go for a subcutaneous route. That means, say for example, insulin. You might have seen nowadays in each and every house we have a diabetic patient who are getting self-administered by this insulin. So the subcutaneous route is self-administrable. Matlab, you don't need any nurse or doctors or any specialist for administration of this injection. So subcutaneous injection can be self-administered. Either they use this subcutaneous region or the thigh region, or here they use for administering this insulin injection. So example for those drugs which can be given through this route are heparin and insulin. So subcutaneous drug, you can administer this heparin and insulin. So when this route is preferred, when you don't need any rapid onset of action, or when the oral route is not preferred, then we have to go for this subcutaneous route. So there are injections available, syringes, insulin syringes, which will just get pricked until the subcutaneous region. So here the drug absorption will be less, slow absorption of drug takes place. So to enhance the drug absorption, either we have to improve the blood flow near the region, or we have to enhance the permeation through that region. So how to improve the blood flow? Either go for massage or give some heat, or you have to use some vasodilators. Vasodilators generally dilate the blood vessels and is used for increasing the blood flow. So what we have to do to increase the absorption of subcutaneous drug? We have to increase the blood flow. Blood flow can be increased either by massaging or providing heat at the surface, or you have to use vasodilators like adrenaline. Then you can, another method is that I told you, to increase the permeation. How to increase the permeation? By breaking the connective tissue by administering of hyaluronidase. Hyaluronidase is the enzyme which is responsible for breakdown of hyaluronic acid. This hyaluronic acid is present in the connective tissue between the cells, which makes a tight junction which will restrict the passage of drugs through the cells. So the cells have to be opened, the connective tissue have to be loosened, broken down by means of this enzyme hyaluronidase. So we can enhance the absorption of drug through subcutaneous route either by increasing blood flow or by utilizing this enzyme, that is hyaluronidase. Now the next route is nasal route, that is given through the nasal cavity, not in lungs, not in the respiratory tract, just the nasal cavity. So nasal cavity is preferred for administration of proteins and peptides. Proteins and peptides cannot be given through the oral route. The reason is proteins and peptides get degraded in the GIT. So you have to prefer alternate route for protein drug administration. So nasal route is mostly preferred, and nasal route will have rapid onset of action. Next to this parenteral route, nasal route is preferred when we need rapid onset of action. Even some vaccines, COVID vaccines are available through this nasal route. And another important in case of this nasal route, why this route is chosen? Because it is again highly vascularized region and the permeability of drug will be faster in this region. Now what are the factors which will affect through this nasal cavity? One is the lipophilicity of the drug, pKa of the drug, and the pH of the nasal cavity, and the secretion of mucus, and some diseased state. Which state? Sometimes fever, cold, rhinitis, sinusitis. These are all allergic condition of nasal cavity. And sneezing. These may cause sneezing effect. Sneezing prevents or removes the foreign bodies which enters through the nasal cavity. Sometimes drug also can act as foreign body, and that also can be removed through this nasal cavity. And in case of cold conditions or during allergic conditions, these drugs will be removed faster. So the drug absorption will also be affected by this diseased state. Apart from that, molecular size, the drug molecular size plays an important role in nasal cavity. That is, the drug which is lipophilic in nature and having molecular size less than 400 Dalton can passively absorb. But if the drug, even if it is lipophilic and it has molecular size more than 1000 Dalton, then you cannot administer through the nasal cavity. Then you have to include permeation enhancer to permeate the drug to pass through this nasal absorption. And the drugs which are hydrophilic and less than 50 Dalton in size can use the aqueous pores for transportation of drug. So apart from lipophilicity, pKa and the nasal pH, we have molecular size also affect on the nasal drug absorption. Now the next route of drug absorption is pulmonary route, that is the respiratory tract, generally lungs. So we have to use orally for administration of pulmonary route. Through inhalation, we just send our drugs to the respiratory tract. Till alveoli we can target the drug. So when this pulmonary route is preferred, when we use these inhalations during asthmatic condition or in case of anti-allergics or in case of anti-inflammatories. So the drug, anti-inflammatory drug, asthmatic drug and anti-allergic drugs can be given through this pulmonary route. So why this route is preferred? Why lungs for drug absorption? Because lungs is also a highly vascularized region. You must be knowing that next to heart receives the whole blood volume, that is 6 liter blood volume each minute. And next to heart, lungs is the organ which receives the maximum blood flow. So highly vascularized organ, and also the pulmonary epithelium is having high permeability, as well as the exchange of gases takes place in the lungs, leads to good pulmonary drug absorption. That is the reason pulmonary route has been chosen, or lungs has been chosen for the chosen as the route of drug administration. So generally these drugs have been preferred. Now what are the factors which will affect the drug absorption through this pulmonary route are lipophilicity, pKa, and again molecular size. Can any drugs can be given to the lungs? No, it is not possible. That is, the drug having molecular size less than 5 micrometer only can pass through this lungs. The drug having size less than 5 micrometer, not more than 5 micrometer. If it is more than 5 micrometer, that will be removed out from the lungs. It will be either removed from the nasopharyngeal region, or through larynx it may come out, through nasal cavity it may come out, or through oral it may come out. So the drug which is having particle size or molecular size, particle size less than 5 micrometer can reach the lungs and can be deposited into the regions of lungs. If the drug is given in nanometer size, then it can deposit in alveolar region of lungs, which will have systemic drug absorption also. So pulmonary route is preferred during the cases when the drug have to be given locally in lungs, not only for local action. Nowadays this pulmonary route is preferred also for systemic absorption of drugs. Next route is intraocular route, that is the drug administration through eyes. Again, it is a highly sensitive organ, and why this is, again, better blood flow and the local action when you need in eyes, like mydriotic drugs, meiotic drugs, or anti-allergic drug, or anti-infective drugs. If there is infection in eye, we cannot take tablet, we have to use eye drop. So if you need local action in eye, you have to use this intraocular route. That is, you can use for anti-allergic drugs, mydriotics, meiotics, as well as for some anti-infectives. Or the example for this intraocular drugs. So what are the parameters to be considered or the factors to be considered in intraocular route? That is, its pH, drugs pH, because pH is more important in case of, first of all, that formulation should be sterile. Like in parenteral formulation, even ophthalmic is also sterile product, so it must be sterile. First of all, pH should be maintained. The pKa, depending upon the pKa, the drug permeation may be affected, and the lipophilicity as well as osmotic pressure, it should be isoosmotic with that of eye. That also to be considered in case of eye. Apart from that, eye irritation, the drugs may irritate the eye, so we have to consider those, and all the factors for drug absorption. Blinking of eyes, we blink every second, so blinking of eyes also may affect the drug absorption. Blinking of eyes, and volume of tears, and volume of drug that is present, because only even a single drop, only one drop can be placed in the eye. Also the viscosity of the formulation, so the volume of formulation in eye and the viscosity of formulation also plays an important role in absorption of drug through intraocular route. And the next route is topical route. Topical route means drug administration through skin. So skin is the largest organ present in the whole body. Skin is the largest organ, weighs about 2 kilogram, and its area is about 2 meters square. So it is the largest organ in our body. So why not to use the skin as a mode of drug absorption? That's why we use topical route for drug absorption, non-peroral route of drug absorption. So there are 3 layers present in the skin. What are the layers present in skin? Which is epidermis, dermis, and subcutaneous layer. And in epidermis, it is again made of multi-layers. One layer is stratum corneum, which acts as the barrier to skin permeation. You know that any material or dust particle that is falling onto your skin will not get absorbed into your body. Why? Because it acts as a barrier. So even if it enters, stratum corneum is there in epidermal layer, which acts as a protective barrier, and it will not allow that material to enter inside your body. So the barrier for drug absorption is the stratum corneum, which is in the epidermal layer, and the dermis layer is considered to be the highly vascularized layer. So the drug absorption can be faster in case of this topical route also. So which type of drugs can be given through this? Again, all these antihypertensive drugs, analgesics also can be given, and some antiemetic drugs, scopolamine is also available as topical formulation, and some steroidal drugs like estrogen and testosterone can be given through this topical route. Now what are the factors which will affect the drug absorption through the skin? Is the molecular size of the drug, that is less than 500 Dalton, the molecular size of the drug should have. Then only the molecule can pass through the skin. So the molecular size of drug should be less than 500 Dalton. And the lipophilicity, more the lipophilic, more greater will be the drug absorption through topical route. So the lipophilicity also should be higher, that is should be also 5 or greater than 5. And then pK of the drug, that is ionization, anionization will also have permeation effect through the skin. Now the last route preferred for this alternate route of drug absorption or non-peroral route is vaginal route. Vaginal route, why it is considered to be the last route? Because it is gender specific. It is the route preferred only for females, and in local action we can use this route. So what all the local actions can be done by this route is, one is contraception, and another for the infections like antifungal drugs can be administered through this route. So for mainly for infection and for contraception purpose or for hormonal therapy, if you need to administer any hormone, since the uterine organ is just placed nearby this vaginal cavity, absorption may be faster directly to that particular organ. That's why vaginal route is preferred for some uterine related diseases like hormonal disease, contraception, and vaginal infections also preferred. all the factors which are mainly considered for using this route. So the antifungal drugs can be administered through this vaginal route, or some drugs, mainly the hormonal drugs, again progesterone, estrogen, can be given through this vaginal route. What are the factors which will affect the drug absorption through this route is again lipophilicity, pK of the drug, pH of the vagina, as well as the enzymes present in the vagina. Microflora, apart from intestine, it is also present in the vaginal cavity, and the presence of microflora also affects the drug absorption through this vaginal route. So this completes the factors influencing the drug absorption through non-peroral route. Again, this may come in as long answer or in short notes, that is in 5 marks, or it may come in 10 marks. So if it comes in 10 marks or 5 marks, first of all you list down all those non-peroral routes and mention when this route is suitable for drug administration and what all the why this route is chosen. First of all, when this route have to be given, or